Also tonight, lime green ribbons in D.C. Did you see any of them? To spotlight what some call a hidden epidemic, Lyme disease. Our Living Well team stopped by hearings underway today where some say current guidelines on diagnosing and treating Lyme fall way short. Patients and advocates gathered today to watch closed-door hearings at the Ronald Reagan Federal Building to share their stories and their frustration of living with Lyme.
I started having back pain in my late 20s. I started having knee pain in 2000, right around 2003, 2004. And then 2005 started having neurological pain.
Stephen Thomas is one of them, a school teacher from Arlington, Virginia. After years of suffering and after several misdiagnoses, he was finally diagnosed with Lyme disease just last year.
And symptoms just got worse. This is a PICC line that goes.
Today he continues rounds of repeated IV antibiotics, and it's medicine he's paying for on his own because current guidelines don't call for such long-term treatment, and most insurance plans don't cover it.
Your dreams of, being a good dad and being a good husband kind of go downhill when you're constantly in pain. It changes your mood and the ability of what you can and cannot do.
Experts meeting today are reviewing the current blueprint established by the Infectious Disease Society of America and hearing from doctors on the front lines in treating this often mysterious ailment.
With treatment, we have about a 70% response rate. If it's left untreated, then a person can develop neurologic and musculoskeletal, i.e. headaches, the Bell's palsy.
Dr. Sarah Fletcher says as a physician and a patient herself, she wants to reach people sooner and ensure they will get the treatment they need.
Actually, I had the bullseye rash. I had a meningitis from the Lyme disease. I was actually hospitalized for it and treated aggressively early on. So if the guidelines are inaccurate and not reflect all the medical data that we know, then patients can be denied care.
I would never want anybody to go through what we've gone through.
Now, Lyme disease does not always cause that telltale bullseye rash. If you or a family member is bitten by a tiny deer tick, put it in a bag and store it in the freezer. Lab tests could identify the Lyme organism if symptoms show up later on. To see a list of symptoms and ways to prevent infection, go to our website, WUSA9.com, and click on Living Well.